Hey guys, welcome to another video from SkinnyMedic. We haven't really done an update much on our personal life. We've been doing some shorts, Instagram posts, things like that, but we haven't really done a big video on updating what's going on in our life. So we want to take a minute and two and just kind of talk to you about how Gage is doing and kind of the new routines we're going through.
Yeah, have you done any shorts on YouTube or was it all Instagram?
Shorts, we've done a few shorts.
Okay, I wasn't sure what had even been updated.
Yeah.
Well, I know we were doing updates. The last one we really did was November when we came home, right?
I think so.
Or December. It was in December maybe? I don't know. That we did a good update where we were both talking. So December was not good. Gage just continued to have a lot of issues. We ended up on a day trip to the hospital for blood transfusion and a Remicade infusion.
Did we come home for Christmas?
We were in the hospital the week before Christmas too. So we went that day trip.
Yep.
Sometime the 1st of December, we went for the day to get the blood transfusion and a good of Remicade because he was having issues, still having a lot of bleeding that was happening. And then we ended up back in the week before Christmas, like that Monday. And he just was having a lot of bleeding, which is a side effect of ulcerative colitis when you have the inflammation in the colon. It was just severe enough to where he was bleeding when he went to the bathroom. So he kept having his hemoglobin drop. And I think right that week before Christmas was when they called after hours. The lab got his results, called the doctor's office after hours, and the doctor's office called us and was like, go to the ER. Yeah. It was at a 6 that day. When they done it that afternoon, by the time we got to the ER that night, they checked again, it was a 5.3.
Yes. And
he did not demonstrate that it was that low.
No, like 5.3 is dangerously low. Like that's life-threatening numbers there we're seeing.
Yeah, I think anything under 6.5 is considered life-threatening. So he actually went by ambulance. So we didn't sit in the ER long, thankfully. We went straight back to a room, but we did not wait long in the room before they had a room on the children's floor. So we were up there a week, got a blood transfusion, back on IV steroids. He had got a Remicade infusion the morning before going to the hospital that night, but then went ahead and did another one that week at the hospital, trying to get ahead of his symptoms because we were only making it about a week and a half on the Remicade infusions before all his symptoms kicked back up and then the bleeding kicked back up. So the doctor was like, let's try to just go ahead and give a second one, which they normally do not do. He was supposed to, at this point, have been going out a month for every infusion, and we were making it a week and a half when he was needing one, and he was really getting them at 2 weeks. So we were just having a lot of trouble controlling with medicines. We'd already done the Humira injections, and they didn't work. So we were there a week. We came home Christmas morning. We
met with a surgeon during that time and kind of talked to him, and he was like, hey, I'll pull the trigger on surgery today if you guys need to. I think technically it was like the next day. But, I'd hate to do that right before Christmas, things like that. We kind of told him we have a ski trip coming up, and he was like, well, let's just kind of wait and see the first year, see how the medicines go. And then we were really nervous. Like, we were asking God for a sign, like, please, like, show us, like, making the right decision. Because giving Gage an ileostomy, an ostomy bag is life-changing, and we want to make sure we're making the right call. And then right as we're getting ready to, like, finish up discussion with a surgeon, he was like, can I pray with you guys? And me and Candace, like, bawled during that time. So we kind of knew, we felt like we were praying that God would open a door for us and lead us in the right direction, that we were running out of medicines to keep working on, and that we want to make the right call for surgery.
Yes, and that's not an easy decision to make. And Gage had been okay with surgery. It had been discussed back in November.
He was ready to pull the trigger.
He was tired of feeling sick, and he would have pulled the trigger sooner, but we had only tried one medication. And there were several, and so we had agreed, he even agreed that, yep, let's give the medicines a chance. So they had hoped that getting ahead of the symptoms, maybe the Remicade would do it. We were home through Christmas, and then his hemoglobin started dropping again. And so the doctor called and was like, it's time to start seriously discussing surgery. He's going to have to come back to the hospital. The discussion initially was to do the temporary surgery where they would just disconnect, and he would have a colostomy bag, and they would leave the colon in there, and they were going to treat with Entyvio for 6 months to give his colon complete rest and have the bag, and then they would do a reversal back to using the colon after it got healthy. And so we were discussing that option, if we should go that route or not. And he had 5 GI doctors that were on the team. He has a primary, and then we met all the ones in the practice because we were in the hospital so much, they rotate to a week at a time. So when we actually got admitted, the doctor who was the admitting doctor for that week was one of my favorite ones. I mean, we met all of them. They're all nice, but, you know, you connect with one, and she had about 30 years experience. And through talking with her, we asked her and just said, what would you do if it was your son? And without hesitation, she said, I'd remove it completely. I wouldn't do the temporary.
Because he was going to still have symptoms even through the 6 months, because you have a diseased colon inside your body. The body is still going to react to things like that. So he was still going to have issues for the next 6 months, even with doing that procedure.
And the Entyvio is a slow-acting medication, which is why they said they need to give it 6 months and they need to give him rest, because it is slow-acting. And so with his response to medicines, there's a high chance that he wouldn't have responded to it either.
Yep.
So we would have spent 6 more months probably in and out of the hospital, blood transfusions, and by the time it was all said and done, I think he had 7 blood transfusions.
I think so.
From December through January. So that's a lot. We can't keep doing that.
Yeah.
He was just very sick and very miserable. He was still on TPN. Like that basically is what was keeping him healthy. It was being fed through his vein, because everything he ate, if he could eat, went straight through him. Nothing was being absorbed in the colon. Yep. So with that conversation, we made the decision. This was what, January 4th we went back. We made the decision to just pull the trigger and do permanent. And he had already done research with the step-by-step process to possibly do a J-pouch surgery down the road, which is you don't have the colostomy bag, but you have to start with it to allow everything to heal. The doctor had already told us that if Gage wanted to do that part of the surgery, that he would get us in Cincinnati or DC or one of the top surgery places for pediatrics J-pouch, because they don't do that one a lot for kids. They do it for adult, but not for kids.
Like a couple of years here locally. So.
Yes, so they do the ostomy bags all the time, but he had said that he understood us wanting to go somewhere with a very experienced surgeon for that, because they don't do it a lot. He was very humble to admit that and agree immediately, if that's the route we want to go, that he would get us in contact and transfer us to the right place. But we made the decision to do the permanent surgery, and amazingly, he had the surgeon we wanted, had an OR open. We went to the hospital the 4th. We made the decision the 5th, really started the ball rolling, and we had the open OR on the 6th. So that short of notice, we were really lucky, because we were afraid we were going to have to either stay in the hospital a while and wait for surgery, or either go home in hopes we could manage until we could get a surgery date. So that all worked out really good. Surgery is not easy. There's a risk of a lot of complications. My dad had a similar surgery before I was born, because he also had severe ulcerative colitis and had a lot of complications. So we knew there was the potential for complications. We obviously hoped that we would catch a break, that Gage would catch a break, but it did not go that way. So
he's been pretty much bed confined since October, plus the high dose steroids, so we knew there was some risk going into the surgery. Yeah,
and ulcerative colitis puts you at higher risk for a few things, too, that we ended up having to deal with. But the first thing that happened was, and surgery was 3 to 4 hours, ended up being on the longer stretch of that, because when they got in there, the upper portion of the colon, which we knew was in the worst condition, the last colonoscopy it had, they did not even explore up that far because they were afraid of a bowel perforation. It started coming apart during surgery. So when that happens, whatever's in there spills into the gut. So we immediately were under high risk for infection, so he was started on antibiotics immediately for a few days. His incision ended up larger than planned because of that, so then he had increased soreness and was on a lot of pain meds. And of course, his epidural was not placed in the right place. So it was numbing the wrong area. It was only numbing the lowest portion of his incision, so then he was on ketamine, and they tried morphine, and it made him throw up, which then of course made it hurt worse because you're straining. Ended up on Dilaudid. He was on so many medications to try to help control his pain. And of course, the big thing after surgery is they want you to get up and move. So he had physical therapy and occupational therapy coming in. He was doing good, doing what they asked. It was not easy, but he was getting up out of bed. We still ended up with, we started running fevers is what happened, right? We started running about a week after surgery, running some really high fevers, like 102, 103.
Yeah, go to 103 pretty good normally.
And that was with Tylenol, ibuprofen, and cold compresses. It was a struggle.
Heart rate's elevated, still breathing pretty fast, so felt pretty confident that he was septic.
So they did CT scans of the abdomen, and when they did the CT scans of the abdomen, they found a 5.5 centimeter abscess that had formed along with blood clots, which was a little scary.
So he had blood clots in his lungs and behind his knee.
So, sorry.
I didn't ask to see the CAT scan until well after he was healed. I knew how scary, how difficult this could be for him, so I didn't even think to ask for the scan until afterwards. And then I saw this, it was like a couple days before discharge, I asked the doctor to see the CT scan, and he was like, hey, do you know what you're looking at? And I was like, I know just enough to be dangerous about CAT scans. And so when he showed me the CAT scan, you could see the right side of his lungs, right side, had a pretty large clot in it, and then the whole right side of his lung was white. Left side's black, where there's air. White side is the inflammation, things like that was going on with the lungs. So pretty big deal there.
They typically, if the abscess is over 5 centimeters, they put a drain in.
Yep. With
his being 5.5 and then him having 4 clots, they did not want to stop the blood thinners they had started him on. They had started him on Lovenox injections. They didn't want to stop those for the 24 hours in order to put the drain in.
Because you're trying to rank like what is most dangerous, what is life-threatening for him, and let's start treating there. So the PE in the lungs is the most life-threatening, going down to the clot behind the knee, and then the abscess. So trying to rank like what they need to work on is a priority list there.
Yeah. So they decided to hit it with the abscess with antibiotics, and in order to be able to treat the clots. We went about a week, and he actually got worse. So, you know, and they had said, yes, he's going to have breathing troubles, he's going to be tired, and the antibiotics, all these things, but we just felt like he was progressively getting worse, and there was just some miscommunication between the doctors. I got pretty upset, and one of the doctors had already left after rounds, ended up having to call me because I was not happy. We ended up not seeing him through the miscommunications on rounds that day, and I was pretty upset because one of the surgeons during the night that we had called for a breathing episode had said, I feel like we need to rescan him and to see if things are going like they're supposed to be going with treatment. It didn't get told to the day rounds. He came in, we were sleeping, he didn't want to wake us, and it was just miscommunication. But for me, as a mom, seeing my son get worse and seeing him struggling so hard to breathe, and literally one day in the hallway, like I think that was that the day or was that the day before, where he broke down in tears trying to walk, which they told him you have to walk, but it hurt him so bad to breathe. He literally broke down in tears. I was like, this is not, our kid doesn't cry. Like through all of this, he's not been a crier. He's just pushed through. And so seeing that was really hard. So I was pretty upset with missing them. We have great relationship with the nurses. They've advocated very well for him because they know him better than the doctors do. Doctors come in and see rounds. Nurses see him for 12 hours. And they've been seeing him since November. So they helped us advocate. Talked to the doctor through conversation, and the doctor agreed. Ended up running some more tests that night and immediately changed antibiotics too after talking to us. I basically said, how would you feel if it was your kid? And I think he got to thinking about that. And so they ran tests that night, and then the test came back that the abscess had increased and that the clot on the right lung had increased, which was not obviously what we wanted, which explained why those last few days of that week he had progressively gotten worse, because everything was getting worse here. So at that point, they knew they did not have a choice. They had to stop Lovenox to put the drain in because they felt like the antibiotics he was on was not attacking whatever infection was in there. Which was then allowing the Lovenox to not effectively treat the clot on this side, because I think the left side had improved. It was just he was having so much pain and discomfort on his right side, nothing over here was getting better. So on his 15th birthday, he got a drain put in. Supposed to be at home getting his permit, but he got a drain put in.
The nurses did a really good job of like celebrating his birthday. Like they decorated his room. A lot of them got gifts for him, so it really spoiled him on his birthday. It was awesome.
Yeah, the Children's Hospital does a really good job with the kids. even Dietary brought up a platter of donuts for him. So he was very spoiled, but I don't know that he could completely appreciate all that. He felt so bad with having the drain put in, but he did love his nurses and everything they did for him. So the drain, they took some of that fluid and tested it, and they were able to pinpoint exactly what antibiotic he needed for the infection that was in there. They pulled out a lot of fluid while they could, and then they had some kind of, I forget the name of the drain. His karate sensei came to see him and knew exactly what it's called, but it had a little pump, and you could pump to suck some out.
I don't remember what it's called.
I don't remember what it's called anymore, but they were measuring and they were tracking it and they were flushing it, and so they had said it'd be in 4 to 7 days. He had his in the full 7 days.
Figures.
But we did, at least once the drain got put in, he started feeling better. He could not move well then, and so we went backwards to near tears getting out of bed, and I had to get the pain management doctor and the nurse practitioner, the team he had were excellent to problem solve through all of his stuff. With the epidural not being in the right place with him, they had started pulling him off pain meds, and then when the drain got put back in and we were like, he can't move, they want him moving, they were so good to daily make changes to figure out the right dosage, the right pain medicine, so he wasn't nauseous, so he wasn't drowsy, so he could get up and move and do the things he was supposed to do, but not be like in tears because he was hurting so bad. But it was a rough couple weeks. We were in the hospital 5 weeks for this stay.
I think altogether we've done what, close to 70 days?
I don't know. I don't.
Roughly.
It's 10 weeks total between October, November, December, and January. It was a total of about 10 weeks in the hospital. But then they were checking his levels for the Lovenox, and everything started getting better once the drain was in because the fluid was out. It allowed us to be able to actually treat the blood clot efficiently. His breathing got better. We were able to wean him off oxygen because he was still on oxygen at this point. So I think once the drain came out, we finally is when we started weaning off oxygen. The drain was in 7 days. He got out of bed by himself for the first time. He was able to transition from a walker to walking by himself. But he was walking with a walker. He had oxygen. All prior to finally the drain coming out. So we really just had to stay that last bit to finish out the IV antibiotics. They had said we could come home on IV antibiotics since we had the PICC line. We were weaning him off TPN because he was eating. That was a challenge too, is getting him to eat because his stomach was like this big around after surgery, with being so nauseous and not wanting to eat. So we were having to push him to eat so he could go get off IV pain meds and get on oral. And so a lot of teams were coming in working with him. We had infectious disease on board because of the challenge with treating the abscess. But we got him off TPN. Though I think they probably would have sent us home on the IV antibiotics if it weren't for his liver enzymes were a little elevated, and that could have been TPN, that could have been all the medicine he'd been on. It could have also have been a possible allergic reaction to the antibiotic he was on. And so they were watching that. There was no allergic reactions, but they were just wanting to make sure. His PICC line was starting to get a little irritated looking, and they had been checking it and watching it that last week because we were so close to being able to pull it. I don't think they wanted to send us home with an iffy PICC line on an antibiotic. They weren't sure, and we didn't want to have to redo the PICC line on Lovenox. So he just had a lot of complications that we were able to at least work through, and we are home. We came home.
Good news, we're home.
Yes, we are home. It was a challenge, but we made it through. We came home, last Tuesday, and today is Sunday. So we have been enjoying being home and trying to get back into routines. He is doing better than he has in months. He is eating. He is sleeping through the night. He's back in his room upstairs instead of the guest room downstairs. We are still problem solving and working through learning how to handle the ostomy bag. But, I mean, that part of the surgery went fine. Like, we haven't had any surgical issues with that. It's just the learning curve of the new way we do life. Yeah.
So I appreciate all you guys' support. The GoFundMe, people are still donating to the GoFundMe. Obviously, we appreciate that. We have Christian MedShare, but it means we have to pay the bills up front and then get reimbursed. And and we're still working through that. Candace is basically a full-time billing specialist now. So we appreciate all the support on that side. There's been a lot of questions about insurance, stuff like that. So I work part-time EMS, work about 25 hours a week doing that for EMS, and then we still run our business, medicalcareoutfitters.com, full-time. So, you know, that's the way we choose to do life. So we appreciate all the support there. And then I appreciate the people who sent like DoorDash. Like that was the biggest thing that we talked about, that in the future, when we choose to help people that are in the hospital that we're friends with, we acquaintance, things like that, we will absolutely send a DoorDash gift card.
I've actually already sent a few to people.
That's huge because it takes about 2 days and you are tired of hospital food. So if you have a DoorDash, you can order food, order what you want. So that's a great idea if you want to help someone in the hospital, send a DoorDash gift card. You can email it to them, send a text to their phone, and they can do a DoorDash gift card. So that's a really cool idea to help people.
It was especially good for Gage because he couldn't eat a lot of the things the hospital, like the things they'd send for kids to be the fried chicken fingers and French fries and pizza, and he couldn't eat those things at one point. And then when there were things he could eat, like they would send bland food. So it was really hard for him because of all the medications and all his gut issues to find something there he could eat. And they wanted him to eat, especially after surgery. And so DoorDash was huge in helping us get him back eating on a regular basis because, I mean, hospital food's not appetizing, and you're telling this kid he's got to eat as a step to going home. Yeah. So.
Awesome. Well, you wanted me to be on video because you didn't want to talk.
I just said I didn't want to talk by myself. I like it when we can both talk.
Yeah, I agree. I was laughing at you. So I kind of smiled at her. I was like, she wanted me on video. I'm just standing here. Like, I'm not even doing anything.
You've talked. Y'all, you're going to see me smack him on camera.
Awesome. Give me anything else to say?
No.
Awesome. Thank you guys for the support. You guys are awesome. Hopefully get back to the more normal videos on SkinnyMedic's YouTube channel. Hopefully some more after action videos coming, things like that. So kind of get more in the routine of doing gear reviews and getting back to the normal channel stuff. So hopefully we appreciate all your guys' support through this. You never know when you'll be the first responder. Remember, you need the right gear and the right training.